Welcome to the overview presentation of the first phase of implementation of JPND, the EU Joint Programme on Neurodegenerative Disease Research. This presentation is designed to provide overview information on JPND, as well as context on how JPND plans to implement its research priorities. It does not contain specific information on JPND calls, but does describe the processes behind how JPND calls are developed, as well as how JPND funding currently works. JPND has identified, through its research strategy, common research goals that would benefit from countries working together. 5 thematic priorities for future research have been identified in the strategy, which was launched on February 7, 2012. They are the origins of neurodegenerative disease, disease mechanisms and models, disease definitions and diagnosis, developing therapies, preventive strategies and interventions, healthcare and social care. This strategy is designed to guide European research activity in neurodegenerative diseases over the next 10 years. As a first step towards implementing these priorities, JPND has agreed on a first phase implementation plan over the period of 2012 to 2014. The plan has 3 major action areas: annual calls for proposals, action groups to further determine research needs and opportunities in specific areas, action groups to promote engagement, commitment and partnerships, including with the European Commission. Annual calls for proposals. Since the launch of its strategy, JPND has identified a number of near-term priority activities that could be pursued to begin implementing its strategy. Some of the conditions that JPND took into account when devising these activities include the interconnectivities between the identified themes and priorities in the strategy, the degree of EU-wide added value, the level of innovation, the practicality for implementation through existing mechanisms. JPND also considered the scale of the initiatives and the level of investment required to achieve the necessary impact. As a result, JPND now intends to launch calls for proposals each year to address several of these high priority areas in neurodegenerative disease research. Over the period of 2012 to 2014, it is anticipated that JPND will launch calls to address each of the following priority areas: genetic, epigenetic and environmental risk factors, cell and animal models for the identification of mechanisms underlying neurodegeneration, cross-disease analysis of pathways, preventive strategies, evaluating healthcare policy strategies and interventions, systematic reviews of pathways to care, palliative and end-of-life care. As the first step in implementation, 2 joint transnational calls will launch on December 10, 2012, in the following areas highlighted in blue. Pre-call announcements for the topics chosen will be made in September of each year and will be promoted through the JPND website, news feeds and stakeholder database. JPND has assembled a number of action groups which are looking to implement certain priority areas. 3 of these action groups are led by scientific experts and are determining the specific transnational research needs and opportunities in the following priority areas: longitudinal cohort studies, with workstreams addressing both disease-based and population-based cohorts, animal and cell models, and assisted living technologies. For example, the longitudinal cohort group are being asked to consider how to add value to existing cohort investments, for example by increasing accessibility to data and samples, or opportunities for cross-cohort linkage. Each action group will recommend the most appropriate approach to be adopted by JPND for implementation of these priorities, and then JPND will decide on which activities to progress. A number of action groups are being led by the JPND members themselves. These are specific actions to promote engagement and partnerships towards the implementation of priorities. These actions are designed to promote engagement and partnership with a number of different areas, including industry, the European Commission, and other international initiatives. JPND is also looking to link and align current national disease plans and relevant national initiatives to neurodegenerative diseases. It is also looking to promote user and public involvement in research and has specific action groups to look at these areas. As part of its first phase implementation plan, each year JPND will launch activities based on the remaining priorities of the implementation plan, the identified needs arising from the work of its different action groups, the research areas either oversubscribed or unaddressed in the previous year's calls for proposals, as well as any emerging issues from the scientific landscape. This annual cycle will enable JPND to respond in an appropriate manner to the most pressing and urgent research priorities in neurodegenerative diseases. As JPND has 2 calls for proposals out at the moment, to assist those considering applying to these calls, we will briefly describe how the current JPND funding mechanism works. The current mechanism used by JPND is that of the Virtual Common Pot. In this mechanism, following the processes outlined earlier in this presentation, participating national research funding organizations in JPND agree to fund a joint transnational call in a particular area. The funders are free to choose which calls they wish to support, and indeed is dependent on their own priorities and focus areas. Each call features a central application procedure for proposals and is coordinated centrally by a joint call secretariat. Countries only pay for their own successful participants. That is, each country will fund its own national project participants of successful proposals and covers its own administrative effort. No cross-border funding is involved, so funds remain within the borders of each participating country. The funding is based solely on national contributions, so no joint budget is established to finance the selected individual projects. A common question is on the decision-making process of this funding mechanism. Under the Virtual Common Pot, evaluation of proposals is undertaken by separate international expert committees composed of internationally renowned scientists. These committees produce a ranking list of proposals based on scientific assessment and a threshold above which projects will be fundable. Based on this ranking list, the Joint Call Steering Committee for each call, which consists of representatives of the JPND call partner organizations, determines the projects to be funded, taking into account the national budgets available. Based on these recommendations, final decisions are made by the participating national funding agencies and are subject to budgetary considerations. You can keep up to date on all of JPND's activities by visiting the JPND website at jpnd.eu. Here you can sign up to the news feeds, which contain all funding related information and also general research stories from the world of neurodegenerative diseases. You can also search the JPND mapping database for neurodegenerative research activity near you or related to your specific area. You can also sign up to the JPND stakeholder database or follow us on Twitter at JPND Europe. To summarize, we have described the priorities identified in the JPND research strategy and how, through the JPND Phase 1 implementation plan, these priorities are being implemented. This plan consists of annual calls for proposals and several action groups to implement specific priorities. We've also described the Virtual Common Pot funding model currently used by JPND and how you can keep up to date with all of JPND's activities.